Welcome, everybody. Thank you for joining us. Thanks for picking our session here today. This is the BC Better Breathers Club, sponsored by BC Lung Foundation here today. We're November 2024, and we are talking about mucus today. And we are Poplar Pulmonary Wellness. I'm Tina, and this.
And I'm Jenna.
Oh, let's see if I can. There we go. So mucus madness, is this normal? Questions in the minds of people with chronic lung conditions. So that's what we're going to be talking about here today. And before we get started, I'd like to do a quick land acknowledgement. So we are on the unceded ancestral territories of the Coast Salish peoples. These are the lands of the Musqueam, Squamish, and Tsleil-Waututh nations. So if you wanted to share which ancestral lands you are on today, you can pop those in the chat. And we'll read those in a moment here. And we do like to create a safe space for conversation and sharing. So we all come here with open hearts and open minds, without fear of judgment when we're asking questions or making our comments. And we thank you in advance for creating this safe space for everyone here. And this information is shared for educational purposes. It does not substitute professional medical advice from a healthcare provider. And without further ado, Jenna, I'll hand over to you to start the conversation about mucus madness.
Mucus madness. So just with a show of hands, if you, because we've got this nice small intimate group, just raise your hand if you experience cough fairly regularly. Okay. I'm raising my hand too, because this is where this is where I'm at also. And raise your hand if when you cough, it's productive. So you cough out some mucus.
Sometimes, yes.
Sometimes, yes. Yeah, absolutely. And I have this funny little picture of the Ghostbusters, the cartoon Ghostbusters, with Slimer in the background. And ever since I was an RT student, whenever I think of mucus, I always think of this Slimer guy. So raise your hand if you think Slimer from the movie Ghostbusters kind of reminds you of mucus sometimes. Yeah, totally. Mucus comes in all sorts of consistencies, colors, and we're going to explore some of that today. But before we get started, and you're welcome to unmute yourself as well, because we've got a small group, we can have a more of a discussion if you like, or you can use the chat box. Tell me a little bit more about what you would like to know about mucus today. So what are some things you'd like to get out of the session today, or some questions that you have? Go ahead, Bobby.
Sure. I'd like to know about the color of the mucus.
Okay.
And also the frequency of the mucus.
Okay, good question. So mucus color and frequency. Awesome. Ways to loosen mucus. Okay. Awesome, Lisa. We can definitely explore that. So ways to loosen mucus, so you can get it out, especially before bed and in the morning. And those are common times when we do really think about clearing our mucus. So I love that.
Well,
good. All right. Well, go ahead, Alan.
I recently got myself a little Arabica machine, and I just want to make sure I'm using it right.
Yeah, I've got one.
All right. I put some Arabica slides at the end, so I was channeling you, Alan. So we will go do a quick review of the Arabica, and for those who don't know what that is, we'll go through it. We'll let you know what the Arabica is. Little handy device to clear mucus. All right. Okay, so I've jotted those down. Tina, if you wouldn't mind going ahead a slide, that would be great.
I got stuck. Oh, you still see this creature? Okay. I've lost it on my screen. The screen sharing is paused. Oh, there it is. There.
There we go. And we have the lovely Sade joining us, one of our respiratory therapists. All right, so in terms of mucus, one thing I thought I would mention, Sade,
I'm like,
no problem. So one thing I thought I'd mention is, mucus can come from both our upper and lower airways. And you can see it denoted in the picture here. So when we think of our airway, sometimes we naturally just want to think of the lungs, but we should also kind of remember our upper airway. It's all connected, and that tissue that produces mucus is in both the upper and the lower. So sometimes it would be good to know, either noticing yourself whether the mucus is getting generated from your upper airway, and perhaps you might feel a little bit of drip into the lower airway, which could trigger the lower airways, could trigger symptoms. Some people feel that drip, we call it a postnasal drip, some people don't. And if you already know you have upper airway issues, things like allergic rhinitis, which is a fancy name for a stuffy runny nose due to allergies, or if you've got rhinosinusitis, another really long fancy name for if you've kind of got chronic inflammation in your upper airway and are prone to infection, it would be very prudent to be sure that you talk to your doctor about treatments for both your upper and lower airways when it comes to mucus. Oftentimes, you will struggle to feel control down in your lungs if your upper airway is not also controlled. And I'm happy to field questions in the upper airway a little later on, either Tina or Sade or I. But for the purpose of this presentation today, we're going to put a little bit of focus on those lower airways. Does that seem okay? All right. So the lower airways is lined by tissue that we call epithelium. And so on the left-hand side of your screen, you kind of see that kind of red column of cells. And does anyone know what the blue kind of teardrop shape in between those cells are called, or what they are?
Is it the eosinophil?
So eosinophil it's a good guess, Santa. Eosinophils is a type of a white blood cell that's very common in inflammation. And so in this lining of our airways, these epithelial cells, those that are prone to inflammation and the eosinophilic type of inflammation, you might see those cells there, but not quite. The blue tear shape, not quite. Good guess though, Santa. So what it is those are our mucus producing glands. So in our epithelium, in that tissue that lines our airways, we all naturally have mucus producing glands, and they come from goblet cells. And this is part of our very natural defense system. So when you think about our lungs are open to our environment, right? We breathe in air, whatever is in that air, in the air, and then we breathe that in through our upper airway, and there's some filtering that happens there of particles. But otherwise, the air is in direct contact into our airways, and therefore in direct contact with this lining in our airways. So we need a bit of a defense system to get anything out of there that we don't want in our airways. Dust, debris, infections, things like that. So we need a bit of a defense system. And so mucus is actually a natural part of that. And then the other thing that you see on these epithelial cells, and it's kind of highlighted with the picture on the right, where you kind of see those hair-like structures. Does anyone know what that is? Thanks, Tina. Does anyone know what those things are, those hair-like structures? So
Celia.
those are called,
Celia.
yeah, yeah, Bobby, nice. Yeah, you're absolutely right, Celia. And those hair-like structures, they're kind of like sweepers, and they beat very rhythmically, all in the same direction. And so between the mucus and the cilia, we can kind of get rid of stuff we don't want in our lungs. So the mucus is really meant to be thin, watery, very easy for that cilia to trap dust and debris, and then that cilia will start to beat and move out the stuff that we don't want in there. And then the last part of this defense system is our cough. So the way that we get things out of our lungs is to cough it out. And this whole system, the mucus and the beating cilia and our cough, we kind of call that our mucociliary clearance system. So mucus to some degree is quite normal. Anyone have any questions with our natural clearance system?
Yeah, the
And
cilia.
Santa,
Oh, sorry. The cilia are pretty impressive. We were at a talk earlier this year, and somebody was like, did a study where they were looking at the motion of them, and they're kind of like waves, pushing the mucus up, if you can kind of picture that, these little hair-like things. Pretty cool.
awesome. So we'll go on to the next slide. So then the question comes, okay, well, that's nice, watery mucus. That may not be what I'm coughing out. And so we know then that there can be disruptions to this clearance system. And the disruptions might come based on your lung condition. So maybe there's a issue with the airway, like an asthma or COPD, where there's often what we call a hypersecretion of mucus. So the globulate cells are producing more mucus than normal. Maybe there's an issue with the actual airway. So you can imagine nice round open airways might be able to beat that mucus out. But if you've got a floppy airway or airway with a different shape, that might be harder. That would be something like bronchiectasis. Maybe there's a lot of infection that might be in the airway, growing in the airway. And as part of your defense system, maybe there's that, again, excess production of mucus, maybe even thicker, like in non-tuberculosis mycobacterium or cystic fibrosis. And then we also need to kind of think about our cough a little bit, which can get impaired in a couple different ways. Sometimes there's weakness there in our breathing muscles, so we don't have quite as strong a cough. Maybe it's due to a neuromuscular condition, and I've given some examples there. Or maybe it's just, we're in pain, or we have a term for it, SRTs, we call it splinting, where you don't quite get a good cough because you're in pain and you're not using those muscles as effectively to kind of clear the cough. So there's lots of different ways then that this nice pathway we have can get disrupted. Go to the next. Oh, and I forgot to mention, sorry, the other one there was an issue with the cilia itself. So maybe if the cilia are not quite a good shape, if they're not beating effectively or regularly as they should. So there's a genetic condition called primary cilia dyskinesia. So that could be an issue as well. And you can imagine if you have really thick mucus, where that cilia is not quite able to move and kind of beat that mucus out, that could be an issue as well. So again, this nice host defense system can break down in these different ways. And maybe I'll pause here just to see if there's any questions with these different ideas of what could be causing your mucus issue. So if you think to yourself and the type of mucus you experience, does it feel like you just have a lot? Does it feel like it's really thick or hard to clear? What would you say? If anyone's willing to share. Or has anyone been told perhaps that they have an issue with their cilia?
Nope.
No. Okay, yeah, it's not that common. But sometimes if you have ongoing mucus clearance issues, it's worth having that conversation just to see, because it is a genetic condition, and so it could be worth looking into. Okay. We'll go on to the next one. So then what are these strategies? And that's really what your questions have been around. So, and actually, before we go on to strategies, I'll just address Bobby's question in terms of color and frequency. So when you are thinking about your own type of mucus, those two things are really important clues that you can give to your healthcare professionals. And together you can kind of work on what might be going on with your mucus. And the first clue is the color. Um, and so does anyone know, color can be slightly tricky because we're mostly concerned on what your particular baseline color is when you're feeling well. So when you're feeling well and your mucus is at its baseline, what color do you notice with your own mucus?
Mine's kind of a light lime green.
Yeah. So that could be it. And so sometimes it has to do, you know, as a general blanket statement, we would generally say if mucus is kind of clear or white, that might be kind of normalish for you. And if it starts to darken to the yellows and the greens, then that change, might signify an infection if you're having other kind of symptoms. But once you get to know your mucus a little bit, for some of you, you might notice your baseline is a bit colored. It might be green, it might be lime, and or lime green, or it might be yellow. And it might just have to do with the way things are the way it's interacting with different enzymes that you have in your airways. So that's a really good point, Alan, that if you know your baseline is kind of like a limey green, then moving forward, we're going to want to notice changes in that. So if it gets darker green, if it gets brown, if it gets gray, if it's changing color, that is really what's key. Yeah. Nice. In terms of frequency, and it's okay, we can leave it on the screen share. In terms of frequency, that's going to be different for everyone, certainly. You may notice some patterns already, so you may have an idea of maybe what you cough out regularly in a day when you're feeling quite well. And then you may notice if you're starting to feel unwell or you have an infection, then of course the mucus might be more. And so to answer that question, Bobby, again, it has to do with noticing the change. And so again, there's no kind of not everyone's going to fit into a perfect box in terms of how much mucus is normal. It's really going to be different. So I'll just reiterate that the concerns are when they change. So when you have mucus more than your normal, or if you feel like you're having trouble coughing out the mucus that you have and it's causing you more breathing symptoms. then those would be the times to go back to your healthcare professionals and kind of check in. Yeah. Any questions around color or amount? When you're talking to healthcare professionals about amount, see if you could, we usually encourage you when you are clearing mucus to cough it out into a tissue. And kind of have a look at it and know for yourself kind of what's going on. Because that will both give you the information of color, but then in terms of amount, you could kind of figure out in a day how much you might be coughing out. Sometimes we talk about it in terms of teaspoons, tablespoons, just general ideas. But having an idea of amount gives you yourself an idea of what's normal for you so that you can know when you're experiencing the change. And then it helps when you're discussing to your healthcare professional, because they can kind of jot that down and kind of help to know if things are staying the same or if you feel like they're getting a little bit worse. And of course, all of this discussion of change in mucus color and frequency helps us with our action plan. So when we know things are changing, we could take some steps in our respiratory action plan to kind of get us back to feeling at our baseline, feeling good, instead of heading in the other direction where we experience worsening. Does that idea make sense? Okay. Yeah, seeing nodding heads. Okay. And so then let's get to these strategies then where we could feel good. We could feel good, even though we might be experiencing this disruption in our mucus clearance system. There certainly are things we can concentrate on to have us feeling our best. And the first one I've listed here is hydration. So remember, those cilia like to beat in nice, watery, thin mucus. And how well hydrated we are really can, for some people, you really can notice a difference in terms of your mucus. So if you're noticing thick mucus that's feeling really difficult to clear, focusing on hydration, so water, juices, non-dehydrating beverages. So things like alcohol, coffee, teas, those can be really dehydrating and kind of can make that mucus a bit thicker. Has anyone noticed that with themselves? Not really? Well, you're all probably doing a good job with hydration.
I find when I have tea, the hot tea helps me when I have hot tea. Just feels better. Feels better on my throat, and I don't seem to have as much mucus.
Awesome. And it also depends on what kind of tea. I guess when we talk about coffees and teas, we're kind of talking about the highly caffeinated beverages. That might be a little bit more dehydrating. But again, if you're hydrating in other ways, then that's great. Yeah. Does anyone know how to know when they're well hydrated? I'm seeing some no head shakes. Go ahead, Lisa.
Unmute. Yeah, I heard that I should have one really clear pee a day, like no color to the pee, and then I know I'm hydrated. Does that ring a bell?
It does ring a bell. I haven't heard. So the last time I asked a registered dietitian about this, they do suggest looking at the color of your pee definitely as a way to know. And that clear, really light, kind of yellow is a good indicator of hydration. I'm not too sure. I'd have to look into about the one a day. I mean, that sort of intuitively makes a bit of sense to me. So I'll look into that more, Lisa. But looking at your pee is certainly a good way. Yeah, Santa.
Yeah, we can put on our skin. If the skin bounce back, that means we are hydrated. If the skin it does not bounce back, and then that means we are dehydrated. We need more water.
Ah, have you heard that one before, Tina or Sade?
Yeah, I think, well, I've heard the pinching one. So, oh, where's my camera? So like if you pinch a little bit, when you let go, it should go back to being flat. And if you pinch it and it stays up, like this pinch mark stays up when you're not holding it, that can mean dehydration. Although I do see that sort of as we get older, our skin loses elasticity. So you might want to learn your normal when you know you're hydrated with the P method. And then you could compare that to your own skin elasticity. Yeah.
Nice. Thanks for that, Santa. Thanks, Tina. All right. The way that hydration might play in as well is if you're at your baseline and things are feeling pretty good and you're coughing out your mucus regularly, that is great. When things change, so if you have an infection or if you're having a flare up or a worsening and you're noticing that change in your mucus, then you might want to put more emphasis on some of these strategies. And so, for example, it may be at that time that you feel a little more focused on hydration and kind of noticing whether you're well hydrated or not. Our clearance strategy number 2 is exercise. And so mucus is very gravity dependent. So what that means is the more sedentary we are, the more that mucus might kind of settle down. And I meant to show this at the beginning, but if you could see me on the screen, one thing to keep in mind is we can really cough mucus most effectively when it's right about here, right in the upper kind of chest. Otherwise, mucus is happening all throughout our airways, but we have to kind of work it up. We have to kind of work it from those really peripheral airways, work it towards the center, and then work it up to the point where we could get a nice effective cough and clear it out. So if we're a little more sedentary, that mucus might really settle down in those really small peripheral airways. It could be a bit harder to clear. Whereas if we're moving, and moving regularly, you're going to get that mucus coming up and out. And maybe you notice that already when you do your exercise or you go for your walk. Maybe you do notice that you find that you're clearing mucus after. Seeing some nodding heads. Yeah. So I know I'm speaking to the choir here with our participants today. So good on you for keeping on with your exercise. It's one of the #1 ways to help you with mucus. We'll go to the next slide. But any questions with that idea? Exercise as a mucus clearance technique. Okay.
And I notice
So
it
then
when I notice it when I start my daily walks that usually for about the first 3 or 4 blocks that I am getting rid of an awful lot of mucus. And then after that, it settles down to very little comes up during the remaining portion of my.
Right. Yeah. Nice, Alan. So yeah, we might just want to. Oh, go ahead, Bobby.
Sorry. For my mucus, I find that if I'm well, I don't have that much mucus. And if I'm sick, then I do have more mucus. So that sort of gives me to regulate how I'm feeling. Because sometimes I don't really take care of myself. So it gets more than I know there's more. But for over 20 years, I've drank more than 80 ounces of water a day. And
wow.
It just clears it all out and everything. I learned that many years ago to do that, and I've been doing it ever since. So.
Yeah.
But I didn't do it when I was a teenager or a kid. I never ate water. So
right. I know. It's one of those things that maybe we learn as we get a little bit older, how important it is. And of course, I'll just preface and say, maybe for participants that might watch this on video after, we know there are some of you that will have limitations to how much fluid you should be having a day based on other conditions. So definitely listen to the advice of your physicians with that. But if you've got this thick mucus and you're looking to use hydration as a tool, talk to your healthcare provider so you could strike that fine balance between your fluid limitation and then getting enough hydration in. And when we talk about hydration, just to go back to that point, we talked about water, juices, maybe herbal teas, but you could get a lot of hydration from your fruits and veggies too. So that might be another way to kind of get that in. So then we've got medications. So, and certainly inhaled medications, many of the inhalers that you might be on are working to improve, or maybe I should say reduce mucus production as much as possible. And they do that through a couple different pathways depending on the inhalers that you're on. I've highlighted sort of three main pathways here. So one is reducing inflammation, so that epithelium tissue, we're trying to reduce the inflammatory cells that are there. And when we do that, we can in turn kind of reduce the mucus production. Antimuscarinics are a broad family name for some inhalers that work on trying to reduce mucus production. They also are bronchodilators, so just trying to open up the airway a little bit more so that any mucus that is in there is a little bit easier to clear. Okay, some of you may be on medications such as antibiotics or long-term antibiotics. And those long-term antibiotics are in a family called macrolides. So those of you that might be on azithromycin, for example, every other day, Monday, Wednesday, Friday kind of thing, that's working on inflammation. So that might be kind of like a step-up treatment to your plan that might help potentially with mucus production as well. We know when we get sick, we produce more mucus. That's part of our natural defense system to kind of try and get those bugs out of our airways. So we really recommend, in terms of being preventative, our vaccinations. And you might have all been attending a lot of talks on that. So in respiratory, we really recommend the flu vaccine, the pneumococcal vaccines for pneumonia, the COVID-19 vaccine, and the RSV vaccines. And then last but not least, it's not our first line treatment, but perhaps if mucus continues to really be a problem, especially thick, copious type mucus, there are medications called mucolytics that try and break down that mucus, kind of thin it out a little bit and make it a bit easier to clear. And so mucolytics might stay in your back pocket and could be helpful to talk to your physicians about if you ever get to that stage. And last but not least, we have mucus clearance devices. And here we go, Alan. This is where we're going to talk about the Aerobica. But before we do, we want to talk about a specific technique that you might have already been taught in your pulmonary rehab programs. But when we talk mucus clearance, this is the technique we want you all to be thinking about. And we'll go on to the next slide. It's called the active cycle of breathing. Has anyone heard of it or are using it already? No? Okay. All right, so we're good. That's what we're going to go through in this next little bit. So the active cycle of breathing is something that you can use, and I'll address Lisa's question here, in the morning or in the evening whenever you want to clear mucus. So there's kind of a couple different strategies of clearing mucus. You might want to think about how you can incorporate something like the active cycle of breathing or even the Aerobica, which is a device to clear mucus. But even with the Aerobica, we suggest you use a rhythm that's very similar to the active cycle of breathing together with the device. And you might want to think of being preventative and doing this in the morning when you wake up and then at night before you go to bed, because very commonly, if you've been sleeping all night and you're sedentary, that mucus will settle. So as soon as you get up in the morning, you swing your feet, over the side of the bed, you stand up, you go to the bathroom, and you might notice you're coughing or you're feeling your mucus because that mucus from overnight is starting to move. And so the morning is often a good time to clear out that mucus. It's also a good time because you've often got a morning inhaler regimen that you might be doing. And so it might be good to clear out that mucus first thing before maybe you get some maintenance inhalers in there. You also might want to think of it on the other spectrum at the end of the day because you want to be able to sleep and you want to be comfortable and you don't want to be symptomatic with your breathing symptoms. And so it may be a good idea to clear out at the end of the day before you lie down and go to bed. But of course, depending on many factors, whether you're in a flare-up or what have you, you could use this throughout the day whenever you feel like you need to cough, or maybe if you feel mucus there and you're struggling to get it out. We'll go on to the next slide.
Oh, you're home. Yes.
So the goal of the active cycle of breathing is to move mucus where it can be coughed out. Back to that idea that mucus is only effectively going to get coughed when it's sitting right about here. And sometimes we find ourselves in coughing fits or struggling to get mucus out, and that could really tire us out. And if you're in a flare up and your threshold is already a little bit lower in terms of energy, then it can really poop you out. And so we want to make sure when we're coughing, we're not totally depleting all of our energy. And this is where the active cycle of breathing can really help. Thanks, Tina. So here's the cycle here. Now that you see it, has anyone kind of seen that before? There are 3 phases to this cycle of breathing. So there's a controlled breathing phase, and that's kind of that darker box right at the top of the circle. This is where we do our pursed lip breathing, inhalations in through the nose, out through the mouth, perhaps with pursed lips. This is a very calming breathing technique. We use it when we feel short of breath. We can use it as a normal part of this clearance cycle. It helps us, like I said, to calm. It helps to stent open the airways so that the mucus can clear a little better. And when we're in this controlled breathing state, we feel a lot more control over our cough and our breathing. So we're going to start here and we're going to end here. Because after you cough out mucus, in order to stay controlled and not feel like you're going to enter a coughing fit or get really triggered because of your cough, the controlled breathing helps to bring us back to that steady state. So start with the controlled breathing, and even after you cough, end with the controlled breathing. And I think that's probably one of the most important things that we could tell you about the active cycle of breathing. Okay. The next part of the cycle is the 3 to 4 deep breaths. So after you do your regular, maybe pursed lip breathing, you start to deepen your breath a little bit. You start to do some bigger breaths in through the nose. And if the nose is feeling congested or clogged, feel free to do this part through the mouth. You might at this point really want hand on chest and hand on abdomen as you focus on that lower hand, really pushing out as you breathe in and then really feeling it release as you breathe out. Does anybody know what they're feeling with that lower hand or what we're trying to connect with? What's that lower hand placed on? Anybody know?
Well,
Diaphragm.
Yeah, your
Yeah.
diaphragm, it goes out when you breathe in, it goes out. And then when you breathe
Amazing.
out.
Yeah, you guys got it. It's the diaphragm. So we want to connect with that diaphragm or big muscle of breathing, and we want to deepen those breaths. And the reason why, and I'm gonna actually, Tina, if you could stop the screen share for a sec, I should probably show this. Right. So here are my little airway models. The reason why we want those deeper breaths is because here's our nice open airway. So air can flow freely through that airway. And here's our airway that's either impacted by mucus or swelling or the tight muscles around. So mucus can get stuck, especially in those airways that are a bit smaller. And those deeper breaths are going to try and push past any mucus to try and get air in behind so we could kind of dislodge that mucus and get it moving. And the way that those deep breaths do that is either pushing past in the main airway itself, but often airways are connected, especially in our smaller airways, they're connected to collateral airways or airways nearby through different channels. And so if we could get those deep breaths deep down into those collateral airways, we can get air in behind the mucus and really do a better job of pushing it up and out. Thanks, Tina. So the active cycle of breathing then will have us doing about 3 to 4 deeper breaths, and then we can go back to our controlled breathing. Now, just for the sake of time, I'll just say that you could do this cycle attached to your Arabica, so attached to your device. Just make sure your lips stay connected to the mouthpiece of your Arabica the whole cycle. So we want to continue to create a little bit of opening pressure in those airways so that we can get the mucus out. And when you detach from the mouthpiece, you kind of let out a little bit of that back pressure that we're looking for. So those that are using this cycle with the device, like the Arabica, stay attached to your mouthpiece all the way until you cough. And those that are just doing this off any device, use your nose and your mouth as you normally would. And will eventually get us to this coughing part. Okay, so the coughing part comes when you feel like you're ready to cough. So if you feel like stuff has moved up and you're ready, take time to cough it out. For everyone, that's going to be different. Maybe the cough might feel like it comes maybe 10 minutes into this breathing cycle. Maybe you don't need much and it feels like you're ready to cough right away. So the time period of doing this cycle is going to vary. We generally say give it about 10 minutes or so, probably nothing more, because think of this as a little bit of work too, a little bit of exercise. And we're using those breathing muscles and we don't want to get overtired. Okay. When you're ready to cough, we recommend a huff cough. Does anyone know or have used a huff cough? Seeing a little nodding head. Okay. A huff cough is, and maybe I'll get Tina to demonstrate. We could stop the screen share here, but it's a gentler type of cough from the back of the throat, almost like you're going to fog a window. And it's a little bit gentler if you really feel like you end up in those coughing fits that are quite harsh on the throat and maybe not as effective.
Yeah. Did you want me to demo?
Sure. Yeah. I'm gonna. Yeah.
Sure. Yeah. So the difference between a regular cough and a huff cough is almost in the sound of the word. So I kind of like that's that's there for us, so we remember what's what. So a cough has more that hard C sound when you do it, and you use your vocal cords and then muscles in your throat and your neck. And those can get tired pretty easily if you're coughing all day. So a cough would look more like, and it's got a definite sound, a hard percussive sound. A huff sounds a lot more like saying the letter H, and it is more gentle, and it's done with an open throat. So an open airway, open vocal cords, so there's no vocalizing in it. And you do open the airway as though you were going to sort of steam up a window, or you're, like you take something hot and you want to cool it down, and you got like that blowing. So it's maybe a little bit more forceful than steaming up a mirror, but not as forceful as a cough. So you're taking these deep breaths in and then like saying the letter H. Did you have anything?
Awesome.
Yeah.
No, so at the end of your cycle, or when you're ready to cough, you could choose the huff cough as the option. And then Tina said, if you do a regular cough, so that hard C sound kind of cough, do 2 coughs in a row. And so the theory is that the first cough might get the mucus more central, but that second cough is what will get it to clear.
Yeah, you can do a couple huffs in a row too, right? So you'll find a
Yeah.
rhythm that works with you with the active cycle of breathing and the huffing. And the whole goal is to make it easier on you, easier on your muscles. So maybe a couple of coughs or a couple of huff coughs if you can, in that cycle.
Awesome. And then, as we mentioned, cough it out into a tissue. So look at it, get to know your mucus, look at the amount, look at the color. That really is key to noticing changes when you're very comfortable with what feels baseline or normal to you. All right. Does anyone have any questions about that particular cycle?
I have a
Yeah, Lisa.
question about maybe a third kind of cough. I don't know what you would call it, but I think I call it like where you go like the throat clearing kind of thing. What does that fit in usefulness or not? Like it's what I do most, and I really think it's pretty ineffectual.
Yeah. That's a good question, that throat clearing. And it's not, from what I gather, mostly from talking to people in clinic, um, it's not very effective, and it can be very irritating, and it can kind of send you in a bit of a loop, right? Just a continuous irritation that might cause more phlegm. But the fact that that phlegm is in your throat makes me think about a couple things. One is, could that phlegm actually be coming from the upper airway? So is it a drip phlegm? And maybe it's a bit more of an upper airway issue where we need to look at reducing inflammation or mucus production in your upper airway. And knowing a little bit about your history, Lisa, that's kind of where my mind is going. The other thing that's quite common, and that could be very common just with having asthma, a postnasal drip. The other thing that can be very common for all lung conditions, we see it quite a lot in asthma though, is acid reflux. And so acid coming up from the stomach, causing that phlegm or that throat clearing. And remember, acid coming up from the stomach is very common when you live with a chronic lung condition. Many of you are already on medications for it. And the acid is very silent. You might not notice it as heartburn, right? You might not be feeling heartburn, but it's coming up and it's causing irritation. And many people feel that as a throat clearing. So to answer your question, Lisa, my immediate thought was to these differential kind of things, like is it upper airway, is it reflux? And just knowing that is, yeah, it just doesn't do a great job of getting any kind of mucus out, and it just ends up kind of being a little bit more irritating. Yeah, good question. I love that. So we've got just maybe 7 more minutes, and we've got a little game for you at the end too. So I just want to quickly address Alan's question about the Arabica, and maybe we can go to the next slide, and then I'm going to jump ahead a slide. So this is what the Arabica looks like. Respiratory therapists and certified respiratory educators, and maybe some of your other healthcare professionals, when it comes to mucus clearing devices, this is the device we automatically think about for a couple reasons. It's very accessible device. You could get it at your pharmacy, and if your pharmacy doesn't have it on stock, they can order it. If you have extended health and you get a prescription for this device from your physician, you can get it covered. It's very easy to use. It's very easy to clean because, of course, if you're using this when you are infectious, we want you to use it when you're infectious. We want to get that mucus out, but we also want a device that's really easy to clean so that you don't end up with perpetual infections. We can kind of keep things clean. It also gives you feedback as to whether you're doing it right or not. So that's why when we think of clearance devices, there's a lot of things out there on the market, but this is the one we tend to gravitate to for those reasons. If we skip ahead to not the next slide, but the one after, Tina.
Okay, it's also made in Canada.
Oh, nice. That's a good tip.
I like that too.
Canadian made.
Yeah.
You know, the device, like I said, you can use it along with that active cycle of breathing, but choosing, it comes with a resistance. So when you breathe out into the device, you're going to feel a little bit of resistance and you're going to feel some oscillations. And the idea is that it's meant to kind of push past mucus, give it a little bit of a shake or kind of oscillatory feeling in the airway. And that could shake the mucus away from the airway wall and make it a bit easier to clear. But we want to get to that fine balance where we're not overexerting ourselves with this device. So that top picture is showing a resistance setting. So you might want to work with your healthcare provider, respiratory therapist, pharmacist to kind of try and find the right resistance setting for you. When you breathe in and out of the device, you should feel the vibrations. It shouldn't feel too hard. You shouldn't feel particularly depleted after you use this device. So you might want to play around with that setting to find the right one for you. The second picture is just kind of denoting that idea of staying attached to that mouthpiece through your whole cycle of breathing. Because you can breathe in and out of this device, and we want to create that kind of back pressure to push past mucus, that would be the key thing. The other thing is you can listen to the vibrations. You kind of want to hear a steady vibration as you exhale. And if those vibrations are sounding a bit off, maybe this is something, again, you can go through with your healthcare providers. They can have a listen to how you're doing it. You know, that would be one other way to kind of troubleshoot this device. The other thing I would say, and if you watch me in the screen, and I guess this goes back to your resistance setting too, when you breathe out into your device, you want to avoid puffing your cheeks out like this. So those chipmunk cheeks, we don't want that. We want to create all that pressure that was happening here, and we want that to be down in our airway. So you might, when you first start using this device, do it in front of a mirror. And I'll just show you very quickly. You attach to the mouthpiece, your tongue is underneath a tight seal. You're going to breathe in. For some of you, it might be helpful actually to hold your breath in for a second or two, and then you're going to exhale quite steadily. And it doesn't really come across on Zoom, but I could hear those vibrations as I exhale, and it sounded pretty steady.
Yeah, it's too bad Zoom is cutting the sound out.
Yeah. Alan, did you have any other particular questions about how to use this?
No, I was just I wanted to make sure that I'm using it right, and I do believe I am. I guess my only question is like I start out and I take about 10 breaths in and out, and then I huff cough, and then I go about 10 more for the first couple of minutes. Is that a reasonable pace, or should I be going like 3 or 4 minutes breathing before I try clearing? Um,
Yeah, no, it sounds like your rhythm that you've worked out for yourself. It sounds like it's effective and it's working for you. So I would say stick with it. Again, for everyone, this cycle is a little bit different. I think you bring up a good point, Alan, is that even if you do have a good cough, you can hop back on that cycle and continue it until you feel like you've cleared everything out. And the only thing I would say is kind of keep your whole cycle of active cycle of breathing with the cough in about a 10-minute, probably not more than 10 minutes.
Oh,
So,
okay. I've been
yeah,
going longer. I've been going about 20 minutes. And I do
yeah,
in that 20 minutes, I will do 5 or 6 what I call clear
coughs.
to get coughs to get the mucus out. Usually find by the end there's not much more to come out. Um,
Yeah.
I found it's very effective actually.
Great. So I think if you're not pooped at the end of the 20 minutes and it feels like it's working for you, then stick with that, right? That's what you figured works for you. For those that are going to maybe be new to this, in lieu of doing that balance with your energy and just kind of figuring out, we usually stick within the 10-minute. Yeah. Amazing. So I'm going to hand you all over to Tina, and Sade too. Feel free to pipe in with any last minute questions. We have a little wrap up um, game for you. Thank you so much for attending today. And if you have further questions, feel free to ask them in the Poplar community. Just type them in the big chat and we'll get back to you.
Thanks so much, Jenna. I know you've got to go, so thank you so much for that. That was
Yeah.
great.
Thank you, Jenna.
Welcome. Bye, everyone.
All right. But we're not done yet, and I know it's 3 o'clock, so let's just be real quick. We've got a game to play. It's called Truth, Truth, Lie. So 2 truths and a lie. So if you're willing to play this little game with me while we review some of the things that Jenna has taught us today. So the challenge is to identify the lie. So maybe what I'll get everyone to do is just to hold up your fingers, whether it's number 1, 2, or 3, that is the lie. And so we have a few, just like I think 3 rounds of this, if you're willing. So this example here, so number 1, mucus is a normal part of our body's defense system. Number 2, many different lung conditions can cause a disruption in normal mucus clearing, including airway diseases like asthma and COPD. And number 3, when cilia, the hair-like structures in the airway, beat out of sync, that improves mucus clearance. So which number is the lie? Oh, yeah. Yeah, well, everybody got it right away. Yep, number 3 is the lie. So they need to be in sync with each other to have this concerted effort at pushing the mucus out. If they're all going different ways, it's not going to work. And they've got to push against gravity. So awesome. Next one. Number 1, active cycle of breathing should only be used when you're ready to cough. Number 2, active cycle of breathing to clear mucus helps to prevent coughing fits and fatigue. Number 3, huff coughing uses less energy to produce an effective cough. Which one is the lie? Yeah. I'm seeing some. Okay, yeah. Number 1 is the lie. So, active cycle of breathing can be used regularly as part of your mucus clearance technique. So, ideally, twice a day, once in the morning, and once in the evening before bed is a good time to use active cycle of breathing to keep your airways clear. We don't need to wait until we have it built up so much to cough. And the last game here. Proper hydration includes limiting dehydrating beverages like alcohol, coffee, and tea, and that can improve mucus clearance. Number 2, mucolytic medication is used as the first step to treat mucus. And number 3 is inhaled medications working on different pathways in the airways can reduce mucus production. Which one is the lie? Oh, you're so fast. Yep, number 2. So mucolytics are actually quite a harsh medication. We don't want to use them unless we need them, and we have other techniques that we should do first, like active cycle of breathing and other inhaled medications that can help open the airways and reduce inflammation. So thanks for joining us today. We have other events coming up. Gee, we're already looking forward to December. So this Better Breathers Club will be a hybrid one in December. It's on Wednesday, December 11th at 2 p.m. So on Zoom, come out on Zoom, no problem. But we will also be in person at the BC Lung Foundation, and that's on Oak Street at about 11th Avenue, West 11th and Oak, Vancouver. If anyone's in town and wants to join us, please do. And usually we've got some snacks as well. And then we have World COPD Day. This is also with the BC Lung Foundation. This is an online patient forum talking about COPD. We have some great guest speakers lined up. That is on Wednesday, November 20th. So that's next Wednesday from 10 until 12:30. So feel free to pop on at any time there from 10 till 12:30. And then we also have our Poplar Pulmonary Wellness Chat and Chew. We're talking about radon and lung cancer. So this is the last Thursday of the month, November 28th at 1 p.m. That one's on Zoom too. And we are still doing intake for our harmonicas for health and happiness. This is an awesome program funded by the BC Lung Foundation where we learn to play the harmonica as exercise and to learn some breathing techniques like pursed lip breathing. And that is taught by registered respiratory therapists. That is also online, delivered by Poplar. So thank you so much for joining us today. And as we like to say, get out there and live your best lung life.